Would you please welcome Senator John Edwards, ladies and gentlemen.
John Edwards. Thank you, Andy, very much, and thank all of you for coming. What a wonderful, wonderful turnout. And I want your hard questions. Let me be absolutely clear about that to begin with. First, personal note, Elizabeth's doing great. Everybody's always asking about her. She's doing great. We had, Elizabeth and I had a unique experience this past week. We went on a bike ride thing and with Lance Armstrong. And Elizabeth rode some, my kids rode some, Emma, Claire, and Jack, and I rode with Lance for, 9 or 10 miles. And when it was over, first of all, my rear end's so sore I could barely move. But when it was over, we were sitting with our son Jack, and who's 7. Jack's in the middle, Elizabeth's sitting over there, and Jack said to me, he said, "Dad, did Lance ride faster than you?" And I said, "No, he didn't. He rode beside me." And because this is the problem with being married 30 years. Elizabeth said, "Son, that's because he chose to ride alongside your father." Thanks. Tomorrow's our 30th anniversary, though, by the way. Wendy's, that's exactly right. We'll be at Wendy's tomorrow. I'm going to talk I will try to keep this speech relatively short because I want to spend my time answering your questions. I got a few things that I do need to say. My view is that Washington is broken, that it does not work. I think the system is rigged. I think it's rigged against you. And I think there are very powerful interests, entrenched interests, that rig this system against you. It's everything from insurance companies to drug companies to oil companies. They have got this system rigged. And the question is, what do we have to do to change it? My campaign is a campaign of change. I believe we need big, strong, bold change, not small change. And I don't think we can do it without taking these interests on head on and fighting them. There are some people who believe that we can sit at a table with them and compromise and negotiate. I think that is a complete fantasy. They've been in power for decades now. They have billions of dollars at stake. They have absolutely no interest in giving away that power, and they're not going to give it away voluntarily. Somebody has to take them on. Somebody has to fight them. The President of the United States can do that. I've been fighting these people my whole life, and I am ready to do that job. We need it. America needs it. We need big change. Now, I want to say one thing that, a little bit controversial. But I'm going to say it anyway because I believe it. You're going to find that happening all day today. I believe that when we're trying to fight these powerful entrenched interests, that the last thing we need is to have 2 Democratic presidential candidates fighting with each other instead of fighting for the change that America needs. And I want to say one other thing. I'm not interested, I'll speak for myself, I'm not interested in trading one crowd of insiders for another crowd of insiders. I think we need to take the power away from this group of insiders and their lobbyists in Washington and give the power back to you. This is your government. It doesn't belong to them. This is your democracy, and we need to take it back from them. Now, I think there are lots of ways that we need change. We need change in the worst kind of way. Let me talk about a few things. First, our healthcare system. Does anybody think our healthcare system works? No. It does not work. It is completely dysfunctional. 45 million people without coverage. Insurance premiums up 100% over the last 6 years. I've laid out a very specific, I don't think there's but one solution, truly universal health care. And I think I've laid out a very specific plan to provide universal health care. I'll just give you a few basics. Number 1, mandates that everybody be covered. Number 2, we subsidize insurance premiums up to about $100,000 of income. Cover the cracks in the system, which means we treat mental health the same as physical health. It also means we ban pre-existing conditions, no more, outlawed. It means preventive care, long-term care, and chronic care, dental care, vision care, all those things are covered. You can take your health care with you wherever you go, or if you get laid off, if you move from one place to another, you don't have to lose your health care coverage. My plan costs between 90 and 120 billion a year is paid for by getting rid of Bush's tax cuts for people who make over $200,000 a year. I want to take just a second, though, and tell you about a personal experience I had just a couple of weeks ago. For any of you who happened to see the Democratic presidential debate this past week, I mentioned it briefly there, but I want to talk to you about it for just a second because it had a huge impact on me. I did this poverty tour that began in New Orleans and went through a lot of parts of the country. It ended up in the Appalachian Mountains. And I was in the Appalachian Mountains on the last day, and I'm sitting with a small group of people, and there was a man there. His name was James Lowe. He's 51 years old, 3 years younger than me. And he told me about being born with a severe cleft palate. And because he had a severe cleft palate, he wasn't able to talk. Now, this condition was completely fixable. There's a medical procedure to fix it. But he had not been able to pay for it. He had no way to pay for having this procedure done. Finally, somebody came along and did it voluntarily for him, and he got it fixed. Here was the problem. He was 50 years old before it was fixed. He lived for 5 decades in the richest nation on the planet, not able to talk because he couldn't get the medical care that he needed. Now, he was all very kind and noble and grateful about it. It reminded me of a lot of the people that I knew when I was growing up who just worked hard and didn't ask for anything. But my reaction was different. I was outraged. I mean, completely outraged. I mean, how long are we going to stand quietly by and let these insurance companies and drug companies run our country? When are we going to actually stand up to these people?